Inequality is a serious issue throughout the world. There is substantial social and economic inequalities across countries.
While economic inequality is characterized as the unequal distribution of income and opportunity between different groups in society. As with ethnicity and gender, the difference may be merely a base for socially imposed inequities, or it may be a genuine source of inequality, as with health disparties.
Even before the COVID-19 pandemic, social inequality elevated the incidence of pre-existing conditions that worsened various illnesses due to the disparity of healthcare between the high-income class and the low-income class.
During the pandemic, low-income families face greater health risks and significant barriers to accessing quality, affordable healthcare.
Philippine President Rodrigo Duterte has declared a lockdown of the capital Metro Manila
to raise its COVID-19 alert to the highest level,
during which the movement of everyone will be significantly limited.
On January 30th, Philippines recorded its first COVID-19 case in Manila. On March 16th, President Rodrigo Duterte locked down major cities like Cebu to curb the outbreak.
Nahadlok ni pagkahibaw nga quarantine kay unsaon na lang among panginabuhi.
Non-essential industries closed or implemented work-from-home programs. Public transportation was suspended, community events postponed. While many Filipinos could take necessary precautions, the urban poor could not. Christy Baho from Cebu is one of them.
Akong mga anak diri tanan upat. Akong mga igsuon diya sa babaw. Tulo ka buok, wala sila trabaho. Ang akong mama na dito sa Manila na lockdown. Padjud sa una taga diri na jud mi. Nga akong mga igsuon, dagko na lang ni. Na Japan mi dinhi.
Around 20 million Filipinos live in slums, where they have to survive poor housing conditions, lack of sewage facilities, and little to no access to clean water.
Grabe kalisod kay sa una makatrabaho man ko jutay, laba-laba niya ako bana manika dito makakuha og 300, 4, may na lang kay makasudan-sudan mig mga manok, yung na siguro. So kad nakuha ning coronavirus, di ko kalabalabag tarong niya, di ko kay ko kalihok-lihok. Ang bisa jud nga adlaw na gatang kuan, walang-wala jud mi oy. Sobra ka walang-wala para tong sus, wala jud makaw ng mga anak. Nya, sige jud miglugaw, maingon ang mga bata man, sige lang taglugaw ani.
Local government units struggle to take care of thousands of families. Philip Zafra, a city councillor, headed relief operations in one of Cebu's main villages.
Preparing to provide them the provisions, the basic necessities and essentials.
Nagsalig ra pod mi sa ayuda sa barangay. May na lang pod at least naibugas.
For Christy and her family, living hand to mouth meant the daily hustle was their only means of survival. The pandemic has made their difficult lives even harder. But she has not lost hope.
The COVID-19 pandemic has caused a dramatic disruption in the supply chain, causing economic downturns and in the delivery of health services, straining the health system. Due to the sudden economic downturn, small businesses are forced to close and the unemployment rate dramatically increases. Citizens are told to stay indoors. The higher class have another resort for them to continue their work and retreat to their comfortable homes having enough sources.
While on the contrary, the less fortunate are out in the streets, finding jobs, making money, selling products and foods in order to provide for their families, and some are getting caught for not following the law. For them, they would rather get fined and arrested than to stay hungry and cooped up in their respective households.
COVID-19 highlights economic and social inequality. It shows how divisions in different classes of society affect the government's actions in mitigating the pandemic. The government's last resort, lockdown, implementing enhanced community quarantine, mostly known as ECQ, which came on the heels of serious negligence, have contributed to a plethora of complications without taking the primary crisis at hand into consideration.
Social scientists and economists
economists propose various solutions to curb social and economic inequalities. Policies that stimulate job creation and promote wage growth for low and middle-income workers will benefit both the society and the economy. The topmost problem low-income families face is healthcare. In the Philippines, health consultation have costs. Having a healthcare system just like Canada will greatly assist the low-income families in fighting diseases and will greatly improve the overall health of the citizens. Having such a system, everyone will have an easy access and equal services to healthcare, ensuring that everyone has access to proper water and sanitation system, because 1 billion people are subject to the humiliation of and far too often defecation. Many lack basic necessities such as clean water.
Increasing access to education for the world's 58 million out-of-school youngsters. Advocating for improved health systems and vaccine access so that children all throughout the world can survive and thrive. In order to establish healthier and more sustainable communities, all of us must strive for gender equality.
Envisioning all of these will guide us in achieving what we're working towards: equality. A world without systemic barriers, where there is no unnecessary suffering.
A world where equality is a new norm, where every single person, race, religion, and heritage can live a joyful and dignified life.
A world without poverty.
A world where children can live a peaceful life and have smiles on their face.